Welcome back to our exam masterclass. If the simple thought of a dental drill makes your heart pound, well, you are definitely not alone. Today, we're building the ultimate study guide on dental sedation. These are the techniques that make modern dentistry even possible for so many anxious patients. We're going to cover everything from who's a good candidate all the way to handling emergencies, and it's all based on the absolute latest clinical standards.
So why is this such a big deal? Just look at this number. In the UK, a massive 36% of adults, that's more than 1 in every 3 people, report feeling moderate dental anxiety. For this group, sedation isn't just a nice to have. It's often the only way they can get essential dental care. It's literally the key that unlocks a door they'd otherwise be way too afraid to open.
Okay, first things first, let's be super clear on what we're talking about here. This is not general anesthesia, where the patient is completely out. With conscious sedation, the whole goal is a state of deep relaxation. The patient can still hear and respond to your voice, and this is the most important part, their own protective reflexes, like coughing and swallowing, are still working just fine. It's that perfect sweet spot right between anxiety and unconsciousness.
All right, here's our game plan. We're going to follow the entire patient journey, right? From the moment they walk in the door to the moment they're ready to go home. We'll kick things off with a little history, then we'll dive straight into patient selection, the drugs we use, how to deliver them safely, and of course, what recovery looks like. Let's jump in.
To really appreciate just how far we've come, we've got to look back. For a very long time, dental anesthesia had a pretty dark and dangerous history. And understanding that past is absolutely crucial to understanding the incredibly strict safety standards we have today.
This timeline really shows you what a long and frankly often painful road it's been to get to where we are now. It all started back in the 1800s with the ether dome, which was revolutionary but also pretty risky. It actually took until the 90s and 2000s, after a string of really tragic incidents, for major reports to finally force a change. Every single step on this timeline was a hard-won lesson, and it all led to the comprehensive safety standards that were finally locked in place in 2015.
So, with that history fresh in our minds, you can probably see why this first step is so critical: choosing the right patient. This is the absolute bedrock of safe sedation. It's not just a quick chat, it's a formal, systematic assessment to make 100% sure that sedation is the right and safe choice for that individual.
Think of this pre-assessment as being just as thorough as what you'd see for any hospital surgery. It's a 4-part deep dive. We take a full history, we do a systemic inquiry, we perform a mandatory airway exam, that's a big one, and we nail down every single medical detail. The goal here is simple: leave absolutely nothing to chance.
Now, a key part of this whole process is the ASA classification, which is basically a grading system for a patient's overall health. So patients who are ASA 1 and 2, they're in the green zone. They're healthy, they're generally fantastic candidates for sedation right there in a dental office. But as we move up that scale, the risks start to climb. Now, those with more severe health issues aren't totally ruled out, but they absolutely need the specialized care and full equipment of a hospital setting, all managed by an anesthesiast.
When it comes to kids, it can be really tough for them to put their anxiety into words, right? And that's where a brilliant tool like this comes into play. The Modified Child Dental Anxiety Scale uses these simple faces to help children show us exactly how they're feeling. It's a validated scoring system, and it's a surprisingly effective way to get a real, objective measure of their anxiety so we can pick the perfect approach for them.
Okay, so we have successfully selected and assessed our patient. Now let's talk about the tools of the trade, the pharmacological agents and the techniques we can actually use to achieve conscious sedation. This chart is just fascinating because it shows the trade-offs between all the different drugs so clearly. The column you really want to focus on is rapid control of depth. This right here is the game changer. Drugs like propofol and remifentanil, which are given by an IV pump, let us fine-tune the level of sedation in real time. Now compare that to a one-shot injection of midazolam. Once that's in, you're pretty much just along for the ride. That is a huge difference in control.
And this quote just hits the nail on the head. It gets right to the heart of why that control matters so much. It lets us profile the sedation. We can keep things light for the easy parts of the procedure and then deepen it for those more intense moments like an injection or drilling. It's a much more dynamic, sophisticated, and frankly, patient-friendly approach.
Okay, here is a really important update from recent research. We now have solid evidence that using high-flow nasal oxygen, or HFNO, can significantly reduce the risk of a patient's oxygen levels dropping during sedation. For patients who are already at a higher risk, this can be an absolutely crucial safety net. It is worth noting, though, you're much more likely to find this kind of equipment in a hospital than in a standard dental office. So we've got the right patient, we've chosen our drugs, now we are at the sharp end, the procedure itself. Safe delivery is all about creating a controlled environment and, most importantly, being ready for anything.
You know, creating a safe environment is about so much more than just the medicine. It really starts with the little things that help calm a patient's nerves, like a comfortable room, maybe some background music, keeping those scary-looking instruments out of sight. And then it extends to the big, non-negotiable things, having all emergency equipment checked and ready to go, running a full team safety briefing before every single session, and of course, keeping flawless records.
Let's be absolutely crystal clear about this. Continuous monitoring is not optional. It is the absolute standard of care. Now, while a trained clinical eye on the patient is always a starting point, technology is essential. The pulse oximeter, which measures oxygen levels, is the bare minimum you must have. Add in an ECG and a blood pressure cuff, and you've got a complete, real-time picture of exactly how the patient is doing.
Okay, so let's run a quick clinical scenario, a classic exam question. You're right in the middle of a procedure, and you suddenly notice the signs of a complication. Your patient's heart rate drops or their breathing slows down. What are your immediate, life-saving steps?
This table right here is pure exam gold. For oversedation, stop, support the airway, and turn down the infusion. For a vasovagal episode, stop, put the patient flat, and give atropine. For tachycardia, stop and think. Is it adrenaline from the local anesthetic? Is it anxiety? Is it something else? Then treat the cause. Knowing these drills cold is absolutely fundamental.
The dental work is done. High fives all around, right? Well, not so fast. Our job isn't over yet. The final phase is all about ensuring a safe, controlled recovery and providing crystal clear discharge instructions to both the patient and their escort. Getting a patient home safely is a checklist-driven process. Can they walk a straight line without wobbling? Do they have clear written instructions? And the 24-hour rules are ironclad. No driving, no operating heavy machinery, and absolutely no signing any important documents. They must have a responsible adult to take them home. And here's a fun, modern addition to the list. It's actually recommended that someone supervise their internet use, to prevent any, let's call them, post-sedation shopping sprees.
So if there's one crucial point to take away from all of this, it's this. When it's done correctly, modern conscious sedation is an incredibly safe and effective technique. But this safety isn't an accident. It's the direct result of standardized training, rigorous protocols, careful patient selection, and a fantastic multidisciplinary team approach.
And that brings us to our final question. We've seen the whole journey, from the very risky early days of the ether dome to the incredibly safe, protocol-driven practice we have today. It's a massive success story for patient safety. But the question I want to leave you with is this. Have we truly, finally put the ghosts of sedation's dangerous past to rest for good?
Today's explainer was based on the article Sedation for Dental Procedures by Ruth Mawhinney and Alan Hope. Thanks so much for joining us for this deep dive into the world of dental sedation. We'll see you next time.